With blood clots on the rise, even in young people, what actions to take? In this video, I share you with what symptoms might be related to a blood clot, what actions to take, and what happens if you don't. I'm Dr. Jake. I'm a naturopathic medical doctor and an integrative physician in Salt Lake City, Utah. On this channel, I share with you how you heal your body naturally without any harmful drugs or surgery. Be sure to subscribe for more videos like this one. Okay, let's jump in. Do you have symptoms of blood clots? What are some signs that you might be having a clot? So let's first talk about, let's say a blood clot forms around the eye or in the optic nerve. That's going to lead to blurriness of your vision. So if you have sudden blurriness of your vision, you definitely need to get that checked out. It could be a blood clot, could be something else. Also, let's say that you start noticing that there's this red mass that's forming in the back of your leg, where it's forming in your arm. Many times it's going to be forming into your armpit area. It's very red, it's tender, it's painful to touch. That could possibly be a blood clot. And that could even be really scary, especially if it's formed in the calf area, because that's what we call the one that actually forms a pulmonary embolism, which if the pulmonary embolism occurs, that could very likely cause death. So you want to pay attention to that and make sure that is not happening. So those are some areas that blood clots can form. Let's say a blood clot then goes on and it forms around your cardiovascular system, around your heart area. That's going to lead to shortness of breath, chest pain when you exercise. We call that angina. Say you go up the steps, you start noticing pain in your chest. That's an early sign that you might be getting some blood clots that are forming in your blood vessels of your heart or around the heart area. You also could get some dizziness, lightheadedness, a lot of fatigue when it starts forming there. Let's say that you start getting a cough or you're coughing up blood and you have a lot of lightheadedness, dizziness, and fatigue that go along with that. That could possibly be a blood clot that's forming in your lungs. Let's say then we start getting blood clots that are forming in our coronary arteries. These are the arteries that go up to our brain. These can maybe form, you just get lightheaded, dizzy, brain fog, fatigue, you get headaches. These are some symptoms that could lead to that. I know they're not very specific, but then let's say it actually starts closing off, or let's say a clot actually forms in your brain itself. You could start getting some more severe symptoms, transient ischemic attacks, which are little baby clots that can form. Let's say that you get some numbness and tingling in your face, in your arm on the right side, on the left or right side. That could possibly be a clot that's forming in your brain. Or you might be jumbling your speech really quick. Or if this doesn't go away and it stays there for several minutes, you're having a full-blown stroke and you definitely need to go to the hospital and get all that taken care of. So yeah, let's say you get a full-blown heart attack, so your blood vessels get clogged and it gets blocked off and you're not getting blood flow to your heart anymore. That's going to be that you are going to get sweating. You're going to get a lot of chest pain. You're going to get numbness down your left arm, up your neck. You're going to, maybe you even pass out. You're going to feel extremely fatigued and you can't really move very well. These are the symptoms that are going on when you are having a heart attack. Obviously, if you're having these symptoms, you need to go to the hospital as quickly as you can. Let's say you're having a full-blown stroke. These are the symptoms that we talked a little bit about just recently, is that you are going to have jumbling of your speech. You're trying to say a word, but no one's really understanding you. You have numbness and tingling in your left face or left arm, or the right face or right arm, and you start maybe even drooping a little bit. That is telling us that you are having a stroke and you need to go to the hospital immediately for that. Let's say suddenly that you just maybe pass out, or you have this pain in your chest and you feel like you're really fatigued and tired and you can't move. That possibly it could be a pulmonary embolism and you're getting some oxygen in there, but you're not getting a good amount, and that could be a pulmonary embolism and you want to go to the hospital really quickly for that. But many times a pulmonary embolism is you just pass out really quick. And you might come to or you might not. But sometimes it's not like that and you have the symptoms that I just expressed earlier. Causing a stroke, you have your carotid arteries, then you have the coronary. Coronary arteries are around your heart. Carotid are the arteries that are going to go up to your brain. So let's say you form a clot in your carotid arteries, yeah, that's going to lead to a stroke. Or if you form it in your coronary arteries, that's going to form a heart attack. If you suspect a clot, these are some things you need to do. Let's say you're experiencing some of these severe symptoms that I've talked about. You might be having a heart attack symptom or stroke symptoms. Obviously, you need to go to the hospital. Or you start noticing the clot in your leg or your arm. You need to go to the hospital for that also. But let's say you are just prone to getting clots. You start noticing that the clots are coming and going. You're getting some TIAs. Some things that you want to do to help prevent the clots is you could take a baby aspirin. There's also several different herbs that we can take that could work really well. We talked much more in detail on these things in another episode we did. So we could do turmeric, or we got garlic, or we have fish oil, and we have nattokinase, or some things that you could take to help prevent these clots. But obviously, you need to want to prevent the clot to happen in the first place. These are some things that you're doing when you might already have clots, but to help prevent them from getting worse is we want to change our diet. We want to decrease our inflammation in our diet. We want to balance our blood sugar. We want to balance our cholesterol levels, because if you don't, you're going to have the stickiness, which is the inflammation. But if you have high cholesterol and the stickiness, that's going to form a clot, and you're going to get a heart attack, stroke, thromboembolism, or anything like that. So there's a lot of potential reasons why someone could be prone to clots. So like in your husband's case, having cancer is going to make your blood thicker, and you're going to have higher platelets, and that can lead to being more prone to forming blood clots in that way. You could be more genetically prone, like your genetics are a little bit different, and you could be more prone to getting a heart attack, stroke, etc., forming clots in that case. But really the big one is dietary and lifestyle things. So eating a really poor diet that's high in inflammatory fatty acids, high in sugar, you're not exercising, especially aerobic exercise, you're sitting a lot, that's going to cause stagnation of your blood, and that's going to form a blood clot. So you need to get up often, not sit for long periods of time. So if you're sedentary, you eat like junk, you are just a ticking time bomb of forming a blood clot somewhere throughout your body. If you want to learn more about blood clots or heart attacks or stroke, click my video to the right. I'm Dr. Jake, and I'll see you there.